Hi everyone. So let's talk about how to recover from long symptoms after having a serious virus or a virus that made you very ill. And I've been thinking about doing this video. It's very important, and then we'll talk about the new hair look. So if you have come down with a virus and it's caused things like thinning hair, a lot of women are experiencing new hair loss after having a virus, or fatigue, or they're just not at their same energy level, or they're experiencing new brain fog. You know, there's some safe and natural things that I recommend to patients, and these are some easy, over-the-counter, natural things you can talk about with your practitioner, or you can even do your own reading about it. And there's simple things that maybe you're already doing in your life, but obviously, we all know the importance of vitamin C, so eating fruits and some vegetables that are high in vitamin C, right? That's great for supporting the immune system, as well as vitamin D. We know that if you're not getting at least 15 minutes of sunlight a day, you may be deficient in vitamin D, and depending on how light or dark your skin is, you know, if you're very fair, 15 minutes outside in the sun would be great. 15 to 20 minutes. If you're darker skinned, you need to stay out at least 30 minutes a day to process vitamin D in your body. And your doctor can test your vitamin D levels. If you're very, very deficient, they may put you on a prescription of vitamin D, but you know, vitamin D might already be in your multivitamin. So that's something you can consider. Vitamin D works better in the presence of magnesium and calcium. Those three supplements work synergistically together, especially to protect your bones and supporting the immune system. So sometimes when you see supplements that say calcium, magnesium, and D, that's why, because they all work really well together. So omega-3 fatty acids. So you may have heard of fish oil or krill oil or flax oil. Omega-3s help dampen down inflammation. They're very great to help with the integrity of your brain cells, because your brain cells are made up of a fatty layer called a phospholipid bilayer, and it requires omega-3 as part of that healthy fat to create the protective, neuroprotective coating around the brain cell. And some people don't like fish oil. If that's the case, they can go with flax oil. Flax oil is usually tasteless and odorless. I've seen Barlean's brand, and that's a really good brand for the flax oil. And then you may have heard of curcumin or turmeric. Again, that's an herb that you can cook with, but it's also very anti-inflammatory and has been very helpful for supporting the immune system and dampening down inflammation. People also take it for pain. And again, it's a spice you can get at the grocery store. So these are all just very mainstream, over-the-counter items I'm talking about now. Melatonin, I go back and forth a little bit with that one. That is known as an antioxidant to the brain and body. In fact, in some cancer protocols, we use up to 6 to 8 milligrams of melatonin a day to help when the patient is undergoing chemotherapy and whatnot, because how protective it can be to some of our cells. But it is being studied also for recovering from the after effects of having a virus. Now, the part I have an issue with is how much some practitioners are recommending to give patients. I think 6 to 8 milligrams in, oh, I have some dark hair coming through here. We'll talk about my new hair. I think 6 to 8 milligrams of melatonin may be way too much for some people, especially if you're working. I know myself, if I take more than 1 milligram of melatonin, I can barely function the next day. I have a lot of daytime grogginess. So, you know, I'm a little skeptical when I see recommendations online of these high doses, because everyone is so different. So I would say you can talk to your doctor about melatonin. Again, it's an over-the-counter, supplement, but your brain naturally makes melatonin, and it's best released if you can get to bed by 10 p.m. at night, because it's optimally released between 10 p.m. and 12 a.m. And so usually it's like start 9 o'clock, you're turning the lights down, you're turning the light down on your screens that you're watching, and then by 10 o'clock, lights out. There should be absolutely no light in the room, because besides melatonin being released at night, so is growth hormone. And that's why we want to get 7 to 8 hours of sleep a night. One, it helps boost the immune system, because that's where all the cellular repair takes place. And when growth hormones release, that is repairing tissues overnight. You ever notice if you're getting older and you're only getting 4 or 5 hours a night of sleep, you literally feel hungover the next day. It's so important, really for everyone, even young people, to get 7 to 8 hours of sleep, because we know how cancer protective that is. We know night shift workers have a higher incidence of getting cancer because they're not getting that great deep sleep where they're releasing all those chemicals from the brain, like growth hormone and melatonin and whatnot. So, but every now and then, like when I was recovering from a certain virus last year, I was taking melatonin. I only did it for a couple weeks, and then I did wean off it, because if you do take melatonin, it's going to shut down or decrease your own. Its body is producing melatonin because it's detecting melatonin in the body. Your brain's pretty smart. If it detects enough of it, it's going to shut down the production. So, okay. Resveratrol is another, you've probably heard of that before. It's in red wine, right? So another great antioxidant, great at protecting DNA in the cells, and it helps with the length of telomeres, which is inside your DNA. And so again, to support immune system health. And, I'm also a big fan of the different type of mushrooms, like reishi mushrooms. I like doing the lion's mane mushroom because, one, it's been known to be help with brain fog and poor concentration. And I like turkey tail mushroom as well for immune support, but also because I have a family history of breast cancer, and so it's not a treatment, but I like to do it as another protecting mechanism for breast health. And, we could think about intermittent fasting. So what does that mean? You still get to eat, but maybe consider, instead of having a bunch of small meals a day, that you have 1 or 2 meals that you're eating most of your calories. Like for me, I'm not a breakfast person, so I won't have my first meal of the day until about, at the earliest, 12 noon, sometimes even 1. And then I try to be done eating everything by 7 p.m. So that's my eating window, 1 to 7. There's been many studies that show when blood sugar comes down and insulin comes down, when you're in that fasting state, your body can kind of heal and repair and dampen down inflammation. And you want to be in a state of lower blood sugar. So I know some people that do the OMAD, and that's when you're doing 1 meal a day. I'm kind of not at that point. I might consider doing that, but I try to do most of my meal or calories at the lunchtime, and then I'll have a light dinner. But so that's also supposed to be very great for the immune system and health. So those are the bulk of what would help you recover after a virus. And again, all easily obtainable from the grocery store, the health food store, whatnot. But 2 other things that are being studied right now. One of them, I'll call it vitamin I. I'll talk more about it in my live chat this Friday evening. I'll leave it at that right now. It's not really a vitamin. It is a prescription, but I'll call it vitamin I right now. And it is being recommended for study right now by the National Institutes of Health, or the NIH. It is on their main website now that they do recommend it for study, but it is still not recommended to treat certain viruses. Okay. And then we have low-dose naltrexone, or LDN. That is used off-label. Naltrexone is typically meant to get people off of opioids, but that's at like 50 to 100 milligrams. But at low levels, like a 0.5 milligram or 1 milligram or even 2 milligrams, has been known to help with immune support, dampening down the side effects of autoimmune diseases, and possibly slowing down certain cancers. And so there's a lot of research on low-dose naltrexone online. You could check out ldn.org for more information. But what I will say about that is not an over-the-counter supplement. That is a prescription, and an integrative physician or a functional medicine doctor would be the one that would probably know more about that. I know I had to attend conferences and get additional CEU credits to understand how to prescribe low-dose naltrexone and how to use it. So, but they are researching that and treating the after effects of certain viruses. And so I just thought those things were so important, and I just wanted to share them with you. Again, I'm going to talk more about it at the live stream this Friday, and if you have any questions, join me this Friday. Thanks for watching.